Disability advocates are taking little solace in saying, "I told you so," as the New York State Health Department has badly missed its target for transitioning home care workers and recipients. State Senator Leah Webb held a news conference yesterday at the Southern Tier Independence Center, or STIC, to call out the DOH for botching the CDPAP transition to a single financial intermediary. For months, STIC and others had warned that forcing hundreds of thousands of consumers and their caregivers to make the complicated switch in just 3 months would leave vulnerable people without the care they need. The Health Department admitted yesterday that at least 1/5 of the state's 250,000 consumers have not signed up with the new FI, known as PPL. But even those numbers are misleading because DOH lumps those who have initiated the process in with those who have completed it.
Because of the lack of coordination, Senator mentioned lack of transparency, this has caused needless stress for care recipients and home care workers alike. There was a lot of misinformation at the beginning, there was a lot of fear, a lot of confusion.
Joining STIC, STIC was joined by Finger Lakes Independence Center in Ithaca and Access to Independence in Cortland. All three described horror stories of dropped calls, long wait times, an ineffective online portal, and a lack of callbacks. In the 11th hour, DOH announced a month-long grace period in which caregivers could get paid for April retroactively if they register by the end of the month.
Ultimately, when they have to make the difficult decision whether or not to continue to work without pay and support their consumers or find work elsewhere and leave the workforce, that is going to leave people with disabilities high and dry. They're going to end up in emergency rooms, hospitalized, institutionalized, or honestly, worse.
The lawmakers and advocates have been pushing for an extension rather than a grace period. In its news release, DOH failed to take accountability for the crisis, and once again sought to blame some of the former fiscal intermediaries for spreading false information that confused consumers.